Today, as we've said, is focusing on behaviour change. And in this masterclass, the two Claires are going to introduce the COM-B model of behaviour, and we'll be sharing examples of how Impower have used COM-B with clients to design and deliver lasting change, and discuss how COM-B can be used in both delivering change, but also by frontline staff in achieving better outcomes for the people that they work with. Our Better Outcomes, Better Lives team members in Manchester will share our story of how we are transforming adult social care in the City of Manchester. This will be an interactive session with opportunities to ask questions and discuss in groups how you might be able to apply some of these principles of what you've heard in your own organisation. Twitter is #collaborative_NW Northwest. Please, everyone, tweet away about the event. And as we've said, we'll be recording the event, and the link to the recording together with the slides will be available to everybody after the event. I'm hoping there will be time for questions. I'm hoping to be able to make sure we get to the questions in the chat. I'm going to be supported by colleagues in terms of bringing them to my attention to try and make sure we get answers for you. And we'll come to you at question time, so you can actually ask the question. So if you pose it in the box, we will come to you and ask you to present it to the group. Feel free to get your tea and coffee. This is a virtual event, so throughout the morning, if you need to have a comfort break or go and get some tea and coffee. But I think we're about ready to start the event, unless there's anything I've missed, team, or any questions before we hand over to Claire and Claire to go through the behaviour change tools and introduce COM-B. I can't see the chat, unfortunately, so shout up if there is anything I need to cover. Okay, we're going to move straight on to the two Claires, Claire Harding and Claire Tomlinson from Impower, who are going to take us through the behaviour change tools. Thanks, Claire.
Thanks ever so much, Bernie. Great to see you all. My name is Claire Tomlinson. I'm a delivery director at Impower, and I'm joined by my colleague, Claire Harding. Today, we're going to talk you through some behaviour change tools. Many of you who joined last year's webinar, we talked through a different tool, all to do with behaviour change, called Mindspace. And this year, we're going to introduce to you COM-B. Impower is a dedicated public sector consultancy. We work across the public sector, both within local government and in the interface with health. And we really do passionately believe that we can deliver positive change in the work that we do to deliver better outcomes for our citizens. And the work that we've been doing with Manchester, Sarah Broad and Rosie are going to talk through later on today. I'll hand over to Claire just to talk through what we're going to be doing today and to talk you through the rest of the session.
Morning, everybody. So as Claire said, we're going to kind of have two parts to our section. The first is introducing a new tool called COM-B that has wide application with behavioural science and some examples of how we've used that in different settings, and then give you kind of a real life case study of the Better Outcomes, Better Lives work in Manchester. So within that kind of first section around introducing the new tool, we'll just be going over some of the background for anyone who wasn't here last year or who has not committed to memory everything that happened at last year's event, around what do we mean when we say behavioural science. We'll then introduce COM-B as a tool. This is a widely available tool. You can do a Google search and find lots of information. So we'll do a quick introduction, but there's lots of wider resources out there for you to go and do some more research afterwards. A couple of examples, as I said, of where we've used COM-B into the Manchester kind of case study, and then we'll be having some breakout rooms to get you thinking about, well, how can you apply some of what we've talked about this morning to live projects and transformations that you're working on in your own organisations. So first up, I'm going to hand back to Claire for some technical wizardry. We're going to be doing some polling and questions with you. So I think that's on the next slide. Yes, over to you, Claire.
Thanks. So if everyone can either open another browser in there on the internet or get your phones ready. So you can, if you've got a fairly modern phone, then you can use your camera and scan the QR code. Alternatively, I've popped the link in the chat. Oh, actually, sorry, I've just sent it to one person. Let me resend it to everybody. Apologies for that. So click the link in the chat or go to slido.com and enter the code 901724. And there's a question for you to answer. So how do you feel about behavioural science? And so we've got some responses coming in soon. I'll give it another couple of minutes. We've currently got 25 responses. So as we've got 100 on the call, I'm looking to see if we can get around in the 80s, and then we'll reveal the results, and then I will ask the second question. Oh, sorry, actually the second question, if it's changed over the past 2 years, please pop in the chat. So depending on what you responded to in the question. So let's just give it another minute. We've got about 60 responses, still climbing. So obviously everybody's logging on this morning. We just thought a little bit of interactivity to wake everybody up on a Friday is a good way to start the day. Okay, so we've got about sort of 70 odd results. And so the most, the biggest polling result was 61% of you is that actually you feel somewhat positive about behavioural science, and 38% of you feel very positive, and only 1% feel somewhat negative, and nobody feels very negative about it. So it's good that Claire and I are talking about behavioural science this morning. If everyone said they were very negative about it, we might want to end the session a little bit early. So if this feeling has changed in the past 2 years, please pop in the chat and we can pick up some of those comments. I'll hand back to Claire to move on to the next slide and do a bit of an introduction.
Thank you, Claire. Good to know the technology was working on a Friday morning. We'll be doing some more Slido polls later, so more polling excitement to come. So to start with, we're kind of going to be going into some of the background of behavioural science, and then into the kind of what works. So just to give you a bit of a history for behavioural science, it's a relatively new science, origins in the 90s in economics departments in the United States. And kind of found traction in the UK when the Cabinet Office developed the Nudge Unit, which you might have heard of, and that was in 2010. The Cabinet Office Nudge Unit developed Mindspace, which we spoke about last time, and is now a part of the Institute for Government. So a lot of the origins of behavioural science in the United Kingdom were within the public sector, and is very much used and driven within central government, but also, as you'll see, lots around kind of local government and wider public sector use. So we can go on to the next slide. So I suppose a big fundamental thing is, what do we mean when we say behaviour? Actually, what are we wanting to influence, and what are we wanting to change when we're doing behavioural change? And so a kind of broad definition of behaviour is the way in which one acts or conducts oneself, especially towards others. So behaviour is something you can observe, and it's measurable. So it's not what people think or what people's beliefs are, but what they do with those thoughts and beliefs, the actions that we see individuals doing. And so kind of a tip for when defining a behaviour is thinking that it needs to be something that you can film. If you were to turn a video camera on, would you be able to film the behaviour happening? So obviously you can't film what somebody's thinking, but you can film what they're doing and saying. And if there's a way of kind of refining behaviours further. So actually, if you haven't got to something you can film, actually, how can you narrow that behaviour down further? What's the really specific action and activity that it is you're wanting to influence? And the more specific you can be about a behaviour, the more likely it is that you're going to be able to do something about it. So an example might be that you want to reduce car miles driven within your local area. Well, actually, that's very broad. What is it you're wanting to do? Is it a specific geography? You're wanting to reduce car use to take children to school? Actually, you're going to be far more successful if you've got that very narrow focused behaviour that you're targeting, rather than a much broader target. So we can move on to the next slide. So within that, what do we then mean by behavioural science? So we know what behaviours are, but what's the kind of science element of it? So behavioural science is the study of human habits, actions, and intentions. At its simplest, applying behavioural science is about observing people's behaviour that goes back to that video camera element, and structuring interventions in a way that make people more behave in line with the goals that you want to achieve. So you need to be able to state a target behaviour or a future behaviour that you want to see. And sitting behind all of this is about kind of the purpose and intentions. What's that overall goal and benefits that you're wanting to achieve, and what are the behaviours that you need to see to be able to achieve that. We can go on to the next slide. So what does behavioural science actually tell us? It tells us that sadly we don't behave as rationally as we like to think that we do. We're having to make decisions and choices in our life multiple hundreds of times every day, and so our brain makes shortcuts, and we're always influenced by the things around us as to what those shortcuts are, and we're always subconsciously influencing the shortcuts that others around us make. And behavioural science is about being more conscious about how we influence the decisions and mental shortcuts that people make. Kind of links into our behaviours and beliefs are much less conscious than we like to think. So as I said, we're making lots and lots of subconscious decisions every day. Behaviour is context dependent, and the context within which people act can be changed. So that can be the physical context, the cues that are around people, the environment that they're in. Just by changing that can change how somebody behaves and responds in an environment. And I'm sure we can think about the differences between somebody in a hospital bed or in a hospital environment and how they might behave versus when they're in their own home. And actually the same individual can respond in very different ways because of the context around them. And also that we can change behaviour without changing minds. We're not needing to change people's fundamental beliefs or values, but we can change their behaviours and allow people to keep those beliefs and values. So understanding behavioural science enables the public sector to better design ways of working, deliver effective change, and design and implement interventions. And really key in this is that it's for positive purpose and outcomes. So behavioural science is widely used out in the wild, and there might be instances where it's not used for positive outcomes, but actually knowing that we have our professional frameworks and the outcomes that we want to achieve, that we're doing that for positive purposes and wanting to improve outcomes. Citizens, so some examples, either that Impower have worked on or we've seen in the public sector of behavioural science in use. So recycling, household waste, reducing childhood obesity, and the last one's dropped off the bottom of my page. Oh yeah, adults leading active and healthy lives. And I'm sure as you start to become more familiar with behavioural science, you start to see it all around you. It's inescapable, and whether that's because it's been consciously used and somebody knows they're applying behavioural science, or because actually it's something that's just an innate part of how we react, how we behave, and how we influence people around us. So we can go on to the next slide. We'll share these slides afterwards, so don't worry if you're not picking up on all of the content. So this is a couple of examples from recent behavioural science interventions that you will probably all be familiar with, about how the application of behavioural science has influenced the way the public behave. So the first one was in 2012 about the switch of pensions from being opt-in to opt-out, and how that's massively increased the rate of pension savings and people with a private pension, with about 90% of people sticking with the default opt-in option than the opt-out option than before, where it was opt-in. Another more recent one was the introduction of the sugar levy on sugary drinks a few years ago, actually made fizzy drink makers reformulate a lot of their products to reduce that tax that they were going to have to pay. And that's taken 45 million kilos of sugar out of those fizzy drinks every year. So something we probably wouldn't even notice as consumers, but actually changed the way the manufacturers of those products behaved and worked. A kind of novel example from the early days of coronavirus, if anyone can remember back to this, when it was all about washing your hands, and some very novel ways to make sure that you were washing your hands for long enough. So one example was singing happy birthday, or singing other bits of songs, whatever that might be, to actually make the act of washing your hands for that duration seem more fun and entertaining than it might have in reality been. And actually that did change people's behaviours to how they engaged with hand hygiene. And another really recent example, kind of similar to the pensions one about the defaults, is about organ donation. So as a country, we've moved from being opt-in to opt-out, and internationally you can see that nations with opt-out organ donation setups have far higher rates of organ donation than countries with opt-in. And it's not about taking the choice away from somebody. The two options are still available, but it's about the default being the behaviour that you want to see, but still giving people to opt out where that might be something that they want to do. So there's just a few examples, and I'm sure from those you can think of other examples, either locally, nationally, or internationally that have used behavioural science. So if we skip on to the next slide. So I suppose there's a question about, well, why do we want to use behavioural science? There's lots of other change methodologies, project management methodologies we could be using. Applied behavioural science sits alongside all of those. It layers quite nicely into other change and delivery approaches that you've got. It's often very quick to do, so it can be as simple as changing the order options on a form, the language, the defaults, whether it's opt-in or opt-out. It allows you to test and learn because it's something that's often relatively quick. You can try one thing, and if it's not working, you can quite quickly change it to something else. And because, as we said at the beginning, behaviours are measurable, you can evidence the impact that you're having. So you can quite quickly understand from testing whether you're having the desirable impact from the behaviour change or the intervention that you tried. It can be very effective. So there's significant evidence that if applied properly, it can have significant effects on behaviour and outcomes. And there is a trial and error to this. You won't always land on exactly the right application of behavioural science from the start, but with that test and learn, that tweaking and changing, then you can end up with a very effective solution. It can transform people's experience of work. So when we work with frontline teams, we often hear from staff that actually they find their work much more enjoyable, much more fun, that it has much more purpose, and that they understand the reason that they're there and the consciousness of what they're doing and the impact that can have on citizens' lives, and particularly when that comes to using behavioural science to apply strength-based approaches. And ultimately, it's a tool for challenging the status quo. So it just gets us to think about how we could do things differently, but in a positive and supportive way, to improve service delivery and support better outcomes for people. So that gets us to the end of our kind of introduction to what is applied behavioural science. I can't see the chat, so I don't know if any questions have gone in that we want to pick up.
There's none so far, Claire.
Cool. I've got too many windows open on my laptop that the chat is not visible. Well, I will keep going then and move us into Combi. So as Claire said, we introduced another tool called Mindspace last year, and that was a tool that the Cabinet Office developed. Similarly to Combi, nationally and internationally recognised. You can do a quick Google on it and find lots of information about what it is and how it's been applied. So Combi was developed in 2011, so relatively, relatively old in the world of applied behavioural science approach, and it was developed by psychologists at UCL. They saw other applied behavioural science frameworks and decided that they were quite overwhelming and very complicated. So they applied behavioural science to behavioural science frameworks and came up with something that was much simpler and much more accessible to all. It has a lot of traction in the health space. It was designed alongside health psychologists, so those from a health background might be familiar with this already. And again, as I said, it's quite nationally recognised. So if you do a quick Google, you can find lots of examples of how Combi's being used. So if we move on to the next slide, and I'll tell you what Combi actually is. So COMBI is a technique for identifying the behaviour that we want to influence. So when we've identified the outcome that we want to achieve, what that positive change is, what's the behaviour that we need to change to be able to achieve that outcome? And then actually, what are the drivers behind that behaviour? So once we've identified the behaviour, we need to know what the options are, what we can do to influence that behaviour to change. And there's 3 factors that were identified that can influence a behaviour, and they work together. And what you might find is that in different people or at different times, there's a different balance between these different factors. But it's important when applying an intervention to change behaviour that you're thinking of all 3. So the first one is capability. So people must actually have the skills and tools to undertake the desired behaviour. So whether that's our staff having the tools and skills to be able to undertake work in a particular way, or residents. So for example, if we want people to recycle, we need to be providing them with accessible, easily identifiable recycling bins. And so often these can be very simple things, but actually they're real barriers to people being able to behave in the way that we want them to. The next one is opportunity. So these are thanks Manal. The external factors that must support the desired behaviour. So they must not detract from the desired behaviour. So this could be a meeting structure or paperwork or forms or whatever it might be that's external to the individual that would support them in behaving in the way that we want them to. And both of those feed motivation. So we all want to believe that we're doing something because it's the right thing to do and that it motivates us to come to work or behave in a way that benefits society around us. So this is very much about personal purpose and how we fit into the wider environment around us. And all of those 3 things working together can mean that we are much more likely to achieve that desired behaviour that we're after. So now we can move on to the next slide. So COMBI is a really adaptable behavioural science tool. It can be applied at different project stages and to a wide range of desired behavioural changes. So these are just a couple of examples of where we've used behavioural science or COMBI even at Impower, but you can, I'm sure when we go to the breakout rooms earlier, you'll come up with lots more ideas. So it helps to prioritise potential change activity, so identifying where there's the greatest potential to influence behaviours. So actually, if we've got lots of options for change that we want to embed, what are the changes where we think there's really tangible things we can do around influencing capability, opportunity and motivation versus change opportunities where actually that's much more challenging to identify. Helps to around messaging and getting buy-in to a change, helps with communicating to staff or to residents about actually what the tangible things are that they will see that's different that will enable them to behave in a different way and achieve those desired outcomes. Helps us to design change interventions. So actually when we're saying we want to change something, what are the different activities that we need to do or the different changes that we need to make to ensure that everybody's able to engage in that change and behave in the desired way. And it also helps us to benchmark and monitor impact. So I said a behaviour is something that you can measure, but actually often a lot of the changes that you undertake through COMBI are things that you can measure. So for one of the examples we've got coming up later was around performance management and team managers' confidence in using the Power BI and performance dashboards. Well, that was something we could measure. We surveyed staff. We then did some training and surveyed them again and could evidence that their capability in being able to use those reports had improved. And that will come through for opportunity and motivation as well. So they're just a few examples of where we've used COMBI, but as I said, I'm sure you'll come up with lots more. And I'm now going to hand back to Claire for another Slido, I think.
Yes, if we can move on to the next slide. And for those who have got Slido open, you should see that there's a new poll. So which element of COMBI is most important in a change you are currently delivering? So we had about 75 responses last time. So if you are able to log back in and start responding. And then once we've done that poll, I will start the second poll, which is, which element of COM-B do you think is most overlooked? So we'll just give it another moment or two while we're answering while we're waiting for the responses to come through. Claire, there was a question in the chat earlier on, which was mind space versus COM-B, which is preferable?
That's a challenging question. I think you can use both together, which probably isn't the answer that you want. I think it depends on the change that you're looking for and which one best fits. Sorry, not really the greatest answer. So you can use either or depending on the change. I think COM-B is much more adaptable. It can be used at lots of different stages across a project, whereas Mindspace is much more about defining the intervention and the kind of nitty-gritty elements of that. So say if I was going to pick one, I'd probably say COM-B just because it's far more versatile, but I think you can use Mindspace alongside COM-B when designing the intervention. They're not necessarily an either or.
Great, that's really helpful. Thank you, Claire. So we've had 64 responses in so far. So which element of COM-B is most important in a change you are currently delivering? And so at 46%, we have motivation. At 29%, we have capability. And the last one is opportunity with only 25%. So that's how we're currently split. So I'm going to ask the next poll, which is which element of COM-B do you think is most overlooked? So stay with your browser and hopefully there should be a new question that's appeared for you. And there's another question that's just come in the chat, Claire, just to put you on the spot. Are the three not somewhat linked? So for example, if people can see that there isn't the opportunity, they are more likely to start to shift their mindset and start to feel more motivated.
They are indeed. So the way, when you get the slides, you'll see the way the diagram is set up is that capability and opportunity both have arrows pointing into motivation. So it's very difficult to just focus on motivation if you don't have those two elements as well. So they're in particular are linked. So yeah, completely agree.
Okay, thank you ever so much, Claire. So we've got 55 responses. I'll give it another 20 seconds or so just to see if anybody else wants to respond to this final question, which is which element of COM-B do you think is most overlooked? Is it opportunity, motivation, or capability? Okay, I will pause it there with 57 responses. So the one which we think is most overlooked is opportunity at 43%. Motivation came in second at 29%, and then capability at 27%. So I don't know, Claire, whether you think that's surprising or whether from what you've seen, I know you're going to talk through a couple of examples now when we get the slides back up. So I don't know whether you want to draw out if you think any of those, you had to be a bit more proactive in drawing out when you were using these examples.
I don't think that's surprising at all. And I think often the focus on delivering change can be completely on the capability. We do lots of training, lots of knowledge transfer, and expect that people will then leave the training room or the e-learning and behave in a completely different way. And actually the external factors, the opportunity needs to be there, but also they need to be motivated to work in that new way versus the way they've perhaps worked for years or decades, depending on what the change is that we're asking for. So not surprising at all. So we've got three examples that we're going to take you through. We'll talk to these. They're not all from an adult social care background. We've got a bit of a mix actually of children's social care, health, and adult social care, but they're all transferable examples that hopefully will be relevant to everybody. So we can go to the first one. They've all got a bit of a similar setup, but I'll do a bit of talking to them as well. So this was some work I did actually with a local authority in their children's social care department. They had a new director come in who wanted to reinvent how they used performance management. Previously, it had been used very much as a stick to beat people with. People were pulled up when their performance was not good, both teams and individuals. And outside of that, performance wasn't really something that was used in a positive way. So they were rewriting their performance management framework and wanting to land that with staff, but didn't really know how to get staff engaged and motivated about performance management. I'm sure we've all been there. It usually scares people and makes them run away. And so we applied Combi actually in 3 levels. So we thought about how we could use Combi to support staff. This was from head of service to frontline workers, to understand what the performance framework was, their role in achieving good performance, and actually real bit around the motivation as why it was important to monitor and understand performance, and why that was important both for them as professionals, the team and service that they worked with, but also the children and families that they were supporting. We then worked with the team managers in particular about how they could use Combi, and that's where this table comes from, to support performance management within their teams. So both overall team performance, but actually performance of individuals in their team. They had quite a lot of new team managers recently promoted who were really struggling with how to have those conversations with their team members to improve performance. And so we worked to put this table together about the types of questions they could ask their team members to understand where the performance challenge was coming from and how they could support them. So where they thought that perhaps it was a capability issue, how they could ask questions about what the individual needs to be more confident in doing a particular thing, what skills, knowledge or experience they might need, and how they have the opportunity to reflect on their work. So that personal reflection time, some of those questions they might want to use. And we then thought about opportunity. So actually if it was about the external factors that were influencing somebody's ability to improve their performance, actually really getting them to think through. Oh, I see there's a note about an echo. Is that coming through for others?
I'm not getting an echo, Claire.
Oh, sorry for those.
Yeah, there's quite a lot of no's.
Okay.
So
is that any better? Cool. I'll keep going, and apologies for anyone who is getting an echo. So really understanding what the external factors might be that were influencing somebody's ability to improve their performance. So what might be missing, what emphasis do they need, and what are those external factors? And then perhaps thinking about their motivation. So why is it important to do particular things? What does it enable you to achieve? So we used it at that level, and we had weekly check-ins with team managers so they could share the conversations they were having with members of their team and the impact it was having. And that was really important, particularly around that motivation element for those team managers in giving them the confidence to have some of those more challenging conversations. We then also actually shared Combi as a framework with the frontline teams, and got them to think about how they could use it with the families that they were working with. So where they had particular families that perhaps weren't engaging in the plans and options, how might Combi support them to understand why that might be? Was it an issue of capability? Did the families perhaps not understand or have all the knowledge to be able to engage in the plans they were putting forward? Was it about opportunity, so external factors that were influencing the ability to engage, or was it about motivation? Were the benefits of following this plan or engaging in this way fully understood? So this was one project that used Combi in 3 or 4 different ways, and staff really liked it because it was quite simple. It was something they could easily remember and something that they could easily adapt to different settings. So that was that example. The next one, if you're able to move on to the next slide. Sorry, they all look the same but different, these slides, but it's quite a nice template to kind of fit into. So this was a very different situation. This was last autumn. We worked with across 3 hospital trusts, looking at how they could support hospital ward staff to have different conversations on the wards to support more effective D2A conversations and discharges. And so we worked with the staff on the wards, but also the teams around them, to understand what it was they needed to be able to have those better, more strengths-based conversations. And there was agreement from everybody that they wanted to have those conversations. They just didn't really feel able to. And so we used COMBI to frame the different activities and the different change activities we would do. So under capability, some of the suggestions were about increased knowledge of the community mental health offer. Staff didn't feel they were able to confidently have conversations with patients and families about this because they didn't really know what was there. Linked to that, about community services and the discharge process. So often messages were getting muddled or mixed because people didn't really understand what the process was. Some training on how to communicate with other staff members. So actually often there's lots of professionals involved in somebody's hospital admission and their community life. What are the conversations you should be having with those different professionals, and can we have some training around that? And one that came up really clear was around what actually are our roles and responsibilities. I'm kind of doing the job I think I should be doing, but with all the change that's been going on over the last few years, not really sure what I'm doing is what I'm supposed to be doing or adds most value to the pathway here. That sort of fits across capability and opportunity. These don't always fit into neat boxes. So we then looked at opportunity with that group. So actually there must be opportunity for the ward team and social care to be able to discuss what support they need from each other. So they were operating very separately. We had the ward teams obviously in the hospital and social care often still home-based in this case. And they didn't have any fixed forums or regular points where they could come together and discuss what they needed from each other for the patients. And so we set up weekly kind of drop-in forums to discuss patients and plans and make sure everybody was on the same page. Must be the opportunities to learn more about discharge for the ward team. So where were the training opportunities? Where was the comms and information coming from? Kind of linked again with capability, but actually must be the opportunity to learn about communicating with families. So we'd heard that a lot of training courses had been set up, and but staff hadn't been released from their duties to be able to go to those training opportunities. And often those training courses only had a few people. And actually training must be open to both bank and interim staff as well as permanent staff. Otherwise you've got two groups of staff trying to do the same thing, but with different knowledge bases. And motivation was one that actually we had really strong on this project, but still came through about creating a shared belief about what an effective discharge looks like and what the overarching objective is. A supportive culture, so everybody feels like they're part of one team. Actually, if in reality, in structures, they're part of different teams, how can we create that feeling of one team? And creating a belief that doing this will benefit both themselves and the patients that they're working with. And so often what we saw was staff on the ward were putting in place discharge plans. The patient was going home, and the only feedback loop they were getting was when the patient was readmitted. So they only saw in their mind the failed discharges. And so how could we feed back to the ward group where there had been successful discharges, and the work that they'd done to prepare that patient on the ward had resulted in them remaining at home and having a successful, happy kind of remainder of their life, or whatever it might be in the community. So we started working with the community health and social care teams to build up some of those case studies and examples to feed back into the wards, which was really effective. So that was that example. So very different use of COMBI to the one before. And then I'll move us on to the last one. Oh, yes, there we go. So this, again, using COMBI, but in a very different setting. So this was about working with an adult social care contact centre and how staff and the contact centre can be supported to have better conversations at that first point of contact. It's really important in kind of setting the framing about the role of adult social care and about the strength-based approaches. And so this was a workshop that colleagues of mine did with the contact centre staff and got them to think about what were the capability, opportunity and motivations that they needed to help them have those better conversations with staff. So under capability, we had a lot about kind of the information that was out there for residents before they called the contact centre. So whether that was the website, leaflets, other information, often people were calling with an idea about something that wasn't quite correct. And then they were having to spend their time on the call kind of unpicking previous incorrect information. What the contact forms looked like. They asked about having logs and keeping logs of repeat callers, so they had the information that they needed at their fingertips, and particular training that they thought would be useful, particularly around resilience and having conversations with people in crisis mode. Around opportunity, they thought about kind of having a script or a prompt sheet, so actually what was the organisational support that they were receiving, what was the conversations that the organisation wanted them to have, what were the external factors influencing those conversations. About building a criteria for urgency that then enabled staff to be empowered and make those decisions, where previously everything had to be escalated up to a manager who made a decision and then back down to the member of staff. That's quite time consuming when you're live on the phone with somebody or needing to make quick decisions. And then about who was available at the front door team. So could we have a much more multidisciplinary team that meant we'd be able to field far more types of questions and support conversations at that front door point. And then around motivation, thought around workload, preventing delay, and the impact that escalating calls can have on kind of personal motivation, and the motivating factor of being able to get inquiries through to the right team. So it actually works really well in kind of a workshop setting with staff to say, this is where we want to get to, this is the outcome we want to achieve. What are the ideas that you've got that we can do that sit under these categories, these options for changing the way we behave. So I think that brings me to an end on COMBI. I can see lots of comments around how people have already used lots of this and ideas they're taking away. So we'll pick lots of that up in the breakout groups. I'm going to hand over to Sarah and Rosie from Team Manchester.
Thanks, Claire, and thanks, other Claire. I feel like we've got quite a hard act to follow to translate this into real life, but this is real life now. We're not going to be talking in the same structure around COMBI, but I think you're going to see quite a few elements of what both Claires have talked about through our little section. So I'll start by introducing myself. I'm Sarah and I'm the Deputy Director for Adult Social Services in Manchester. So I work for the City Council in Manchester, but I'm deployed into the Manchester Local Care Organisation, which I'll touch on in a moment. Rosie, are you there? Do you want to introduce yourself? Fingers crossed for the tech.
Hi, everyone. Can you hear me okay? Yes.
Yes.
Phew. My name's Rosie Reespan. I'm Change and Transformation Lead in Adult Social Care, working on the Better Outcomes, Better Lives programme.
Thanks, Rosie. So I'm going to start by just telling you a little bit about the background to Better Outcomes, Better Lives and what it is. But before I even do that, just a couple of words on the fact that it's called Better Outcomes, Better Lives, because this is about behaviour change in practice. When we started the programme, Impower colleagues said to myself and Bernie, you need to give it a name. You can't just call it Adult Social Care Transformation or the programme that you're working on. It needs to have a name. And so we came together as a team and we named the programme in a way that hopefully describes exactly what we're trying to achieve in Manchester. And the fact that it's got a name, albeit we do sometimes slip into the rather obvious BOBBLE acronym, does create ownership, understanding, awareness, and ultimately an awful lot of passion in the programme across adult social care and across our wider partnership. And that's really, really important in terms of driving that behaviour change at every level of the organisation. So even the name is loaded in terms of some of that behavioural science theory, I suppose. So a bit of context for Manchester. As I've mentioned, we are deployed in adult social care into our integrated health and social care organisation, the Manchester Local Care Organisation, and that brings together ourselves in adult social care, our community health colleagues, and we work really closely with primary care and mental health colleagues as well in terms of improving the health and care outcomes of Manchester residents. We do have some of the most challenging population health outcomes and inequalities in the country. There's no denying that. And actually what we do know is that the last couple of years of the COVID pandemic have actually increased and worsened those inequalities. And so we're really, really keen to make sure that this programme can contribute to supporting our response to that. In addition, as probably all local authority colleagues on the call can confirm, we've got a challenging financial situation that we've found ourselves in. And when we started the programme just over a year ago, we were set the challenge of reducing our costs in adult social care by £18 million over the next 3 years. That's inclusive of this year. So a really big challenge set actually in quite a difficult context. But myself and Bernie knew that we needed to do something different to just saying, well, let's do less of what we do. Let's reduce the size of our teams. Let's spend less money in that way. We knew we needed to think differently about the challenge. And that knowledge was built very much on the sort of precursor, I'll call it the mother or the parent of Better Outcomes, Better Lives, which is our improvement programme, which Bernie and myself worked on back in sort of 2018 into 2019. 20. So this programme was really set up on the understanding that due to austerity, we had a bit of work to do in terms of strengthening our foundations in Manchester in adult social care. And through the improvement programme, we did actually invest, particularly in our frontline teams. And we'll come back to why that's important shortly. But we invested in those teams because we knew that if we were going to support the people of Manchester to have better outcomes in their lives, we needed appropriate capacity across our frontline teams, so social work colleagues, social care assessors and so on. So we did invest through that programme. Then back in 2020, I can't believe it's 2020 now, but we started working with Impower colleagues, and I have to just give an acknowledgement. I think Henry is out there in the audience today. I don't know if you know this, Bernie, but Henry actually worked with us in her previous life at Impower on the diagnostic work that we did with Impower to really identify opportunities to build from the improvement work that I've described to improve our practice to ultimately reduce, prevent and delay demand on services and improve outcomes. We all talk about reducing, preventing and delaying all the time, but it is quite difficult to do. But actually in the work that we've done since we started the programme, we have started to see some real evidence of outcomes. So from that diagnostic work, we identified a number of opportunities that we felt if we pursued them relentlessly, which we really have done in the last 15 months, that we would be able to make those impacts that we've talked about. So in 2021, we embarked on a 3-year transformation programme, which is very much focused on people's strengths. So it is about strength-based practice. It's about putting support in earlier so people can lead more independent lives for longer, but also the programme is inclusive of some really critical enabling functions. So our commissioning work is absolutely central to the programme, as is our performance framework and how we manage and monitor impact. So I'll come on in a moment to the sort of structure of the programme, but just to trail that we're not going to spend half an hour talking about the ins and outs of the programme. We're going to focus a bit more on our maximising independence work stream and in particular the work we've done around communities of practice. So if we can move on to the next slide, please. So this is a well-used slide, so I'm afraid it's not a special slide for today, but I've probably spoken to this slide. I can't even think how many times. It's in the 20s possibly, because we use this when we talk to everybody about the programme. So we've used this with frontline practitioners when we've launched the community of practice, which Rosie will talk about. We've used it when we've talked to our Manchester Partnership Board, and indeed when we've spoken to our scrutiny committee in Manchester. So this slide is another sort of piece of evidence of behaviour change and behavioural science in action, because it is focused on what the programme is, why we're doing it and how we're doing it in order to to seek to create that motivation and buy-in to the programme at all levels. And I think, I hope that we've succeeded in being able to do that in the way we communicate what we're doing. So the programme is long-term. First important thing to say, we knew at the outset that we weren't going to see impact on day one. Lots of people are quite impatient around some of this and think that you're going to see things happen straight away. We did see things change straight away, but the impact is a little bit longer to roll through. But we absolutely have now started to see that. It's about practice-led change. So as important as myself and Bernie and our other sort of senior colleagues are in the work's really happening at the front line. That's where the change is happening. So really, really important to acknowledge, I suppose, that this is about supporting frontline practice to change how they work and change the relationships that we have with our citizens. And it is focused on supporting the people of Manchester to achieve better life outcomes with less dependence on formal care. So we've described to colleagues why we're doing that, and we knew at the outset there were things we could still do to improve the care experience and how we manage care demand in Manchester. We knew there was more we could do to support our frontline workers and integrated teams, and we knew that we needed to make those significant sustainable savings. We've not shied away from that. This is probably one of the things that we've struggled the most with in terms of how we describe the work, because it is about better outcomes and better lives. And that is our primary driver. We know that by doing that, we believe we can make those savings, but that is the order of priority. And we've been really clear about how we describe the work in that way. So the programme is structured around 6 work streams, and that's the how. I'll very briefly touch on them, and then I'm going to just talk a bit about how we manage the programme in a way that I think talks to some of what Claire was talking to. So our maximising independence work stream, Rosie will talk a bit about how we've been embedding strength-based practice across our teams. We could draw this diagram differently and put this at the heart of the programme, because it is very much at the heart, and probably we've put the most resources, the most effort, the most attention so far into this work stream for really, really obvious reasons. Our early help work stream, we actually didn't kick off with this at the beginning of the programme, an intentional decision that we started it a little later. But now this work is in full flight, and some of our work here touches on some of what Claire was talking about actually around first contact with adult social care and how we can improve and strengthen that. Our short-term offer work is very much about strengthening and growing our reablement offer, as well as how we can use technology-enabled care to support independence. We could talk all day about both of those things, but tech in particular is about behaviour change, because it is about working with people to understand that we can use technology to augment and support individuals' independence and potentially a care package, but can also replace a care package in some cases. And that is quite a challenging thing for us all to relate to. We're not all always au fait with technology, as probably some of us have experienced this morning, but it can be a real tool and enabler to our work, and we need to see it that way. Our See and Solve, or Transforming Community Teams work, has also kicked off, which is about understanding the blockers and barriers to working in a strength-based way, which might be inherent in some of our systems, processes and structures, and working through solutions together to unblock those barriers. I've talked about the criticality of commissioning and how working in a responsive way in how we commission is critical. So when Rosie talks about communities of practice, it's worth noting that we've had commissioners attend those, so not just frontline practitioners, but commissioners attend those to hear from the frontline where the gaps, where the issues and where the challenges are to strength-based practice, so we can then embed that into how we commission. We've got some great examples of that working. And then our performance framework has really underpinned this, and I'll come back a little bit later in terms of some of the impacts that we've been able to measure, which shows the criticality of that work. Before I hand over to Rosie, I just wanted to very briefly mention some of the kind of magic dust, because that's all the sort of stuff in the programme, but what's made the programme work, I suppose. So I've talked a bit about giving it a name, really, really critical. Other thing to note is that we are strength-based at all levels. So you've only seen a little bit of Bernie this morning, and I'm not going to hopefully embarrass her, but Bernie absolutely exudes this way of working in everything she does. So staff can see that and believe in it and are passionate about it for that reason. And likewise, our frontline practitioners inspire us to be strength-based as well in the way they talk. We had one of our team managers attend our programme board yesterday to talk about their experiences, and that motivates and drives us all to want to carry on and continue to focus. So we have got buy-in to the programme at all levels because we believe it's the right thing to do. We've worked at pace, it's been relentless. We really have a really strong kind of infrastructure around the programme to drive that pace. So there is a high expectation on us all that we do deliver. But with that, the kind of flip side to that is that we're really trusting. So we have high trust in our teams that everyone is getting on and doing the right thing. So we're not micromanaging this. So there's sort of two sides to the same coin. We very much have collective responsibility. And another kind of thing for me around behaviour and behavioural science is around diversity. So we have got a diverse team of people working on the programme who all bring different strengths and skills, and we can challenge one another with those strengths and skills, which builds ownership and means that I think we're in a really good shape to continue to deliver the programme beyond this first phase. So I'll hand over to Rosie to now explain whatever on earth communities of practice are. Rosie.
Thank you, Sarah. So if you could move on to the next slide, please. Thank you. So communities of practice are an absolutely fundamental part of the programme and really help to drive and embed the strengths-based approaches and the kinds of behaviour change that we want to see across the service. So they are a weekly forum where practitioners come together and they will reflect on and share experiences of working in a strengths-based way. And that's really, really important, I think, just to kind of explain a little bit of kind of why reflection is important and what role that plays. Taking that step back in the week to look at and routinely look at the impact that you're having on the people that you work with. Really speaks to some of the points that Claire was talking about earlier in terms of motivation. So, you know, this is protected time in the week for practitioners to come together and really look at what was the impact that I had in that situation. Was it the impact that I wanted to have? If it was, great, we can celebrate it. If it wasn't, why not? So it's really, really important in terms of that kind of reconnecting with what people might feel passionate about in terms of their social work practice and the impact they have on residents. The kind of second aspect of the forums that's really important is that peer challenge and that kind of professional curiosity that we can then create within the forums. So it's not just about the individual reflecting on their experience, but about them learning from others as well. So how other people might have done something differently in that situation, other methods or models that they might have used to navigate that situation in a strengths-based way. And it enables some of that kind of positive peer challenge then. And going back to the behaviours kind of point, who do you learn from when you learn a new behaviour and when you think of reconsidering your behaviour? It's often your peers. So the power of having a group of peers coming together is really, really important and moves beyond that kind of traditional training approach. And then thirdly, this also kind of creates new creative ideas within the forum. So the reflective space and that routine bringing together of people to reflect on what's worked, what might have not worked, either using a case discussion or an experience to do that reflection is really, really powerful. And that is our communities of practice, frontline teams coming together. And they are facilitated through the senior social worker within each team. I'll say a bit more about that in a minute in terms of their role. But this is important not just for the discussion that takes place in the communities of practice, but the relationship of those forums to the rest of the programme. So where there might be repeated challenges that come up and barriers to strengths-based working, those can be fed back into the wider programme. So Sarah made reference to the responsive commissioning work stream. and say if there are commissioning gaps in services that are identified, those can then feed back into the programme and be picked up and looked at as part of our programme of change. So we have this kind of direct input from frontline practice in terms of what's getting in the way to them working in a strengths-based way that can then be addressed. And then finally, the kind of third kind of forum from this is support with that personal development and knowledge and awareness of what might be available. So we also run spotlight sessions. The agenda for those sessions are kind of led by and dictated by the kinds of discussion that takes place in the facilitated communities of practice. So where there might be a gap in knowledge or something that might need like awareness of a particular service offer, we give space in the week for that to be showcased through these spotlight sessions. So it's a very dynamic kind of process of both sharing learning and sharing knowledge, and then also the discussions then feeding into the programme of change. So I think we move on to the next slide, please. So just in terms of our communities practice, then really is a practice-led approach to behaviour change. A reference we've kind of built on previous training programmes that have been run, but the role and the contribution of those reflective conversations provides a much more kind of concrete learning experience. It's not just about listening about strengths-based approaches and ways of working in a classroom situation. It's about reflecting on live experiences that practitioners might be having and sharing their knowledge and awareness of different ways of working to address some of those challenges that they might face. So it's very much in that kind of behaviour change a sphere of really building on concrete knowledge into ability. We've also, through this kind of network and these forums, really enabled the frontline practitioners, the team managers, the senior social workers to actually be the change and to support that change. So the change team themselves provided some support with training up facilitators to deliver these sessions, but actually they're leading it and they're taking that forward and they have ownership of those forums. So it's really collaborative approach, much about getting alongside the frontline teams and not about kind of dictating and a dynamic of dictating what behaviours we want. It's a really kind of enabling organic conversation that then takes place. And then in terms of our kind of change approach and the behavioural insights that have been used, this forum builds the space in the week to really talk about behaviours, and it's really about carving out that time to talk about that and to think about that, and it's to consider that in everything that we're doing. And that's the kind of driving kind of energy within the communities of practice. And then finally, we've developed these forums iteratively. So we've launched them and provided training to facilitators, then taken over the forums, and based on the feedback of how they've then been delivering those sessions, we've then adapted and tweaked the approach slightly along the way. And again, that builds even more kind of buy-in then and ownership of what these forums do and how the groups are brought together. So we've been really considered in changing our approach to adapt to that and to bring people with us. And that's kind of highlights some of the main aspects of communities of practice. I think I'm handing back over to Sarah now in terms of some of the impact.
Yeah, thanks, Rosie. I'm just going to quickly just reflect on some of the comments in the chat before I do that. So Rosie, stay on, because one of the questions is around just elaborating a bit more on what strength-based approaches are and how they look and feel different for staff. So do you want to just give your kind of your sound bites on that? Thank you.
Yeah, so definitely. So within the kind of, that we mentioned that it goes right through from the original kind of diagnostic work of the programme, feeds right down into what does strengths-based practice mean and what are some of the behaviours that we might want to change. So we we actually have these strengths-based mantras that are used and adopted, but they're not, I'd say they're not delivered in a way that makes them seem like a list of things to follow or a list of things to do, but they are a kind of, some guiding kind of sound bites that we use to help that reflective conversation. So things like, firstly, starting with strengths. So it's not about starting from deficits or starting from what people can't do when we're working with people. It's about starting with what people can do, or what is their potential to do something. So firstly and foremostly, probably the most important one is ensuring that we start with strengths in everything that we do. Secondly, exploring the least restrictive option. So we've mentioned about the kind of role of commissioning, the role of tech and the short-term offer from a work stream perspective, but how that looks for frontline practice is, starting off with what can the person do, and then exploring what's available in their family network, how can their family support available then in their local community, how can local community or local community assets contribute to that person's support plan, or support them in a way that's much more kind of local in their area. Then look at what the short-term offer is, how can tech support someone, all before thinking about a kind of commissioned care package and what that looks like. It's not to say that that wouldn't be relevant for some people, it's just to ensure that everyone is thinking about those least restrictive options first. And then I'd say the kind of like third, then key one is, it's put me on the spot now. I'm trying to remember the third one.
Sorry, Rosie, I don't want to put you on the spot.
Yeah, I mean, they're the main two ones I would say. We have about 5 that we kind of relate to within the community practice. But yeah, they're not to be a script that's not used in that way. It's more as like a prompt.
Yeah, and I think it is about having those repeatable reminders, and sometimes some of this is about repeating ourselves a lot, because I think for us all to understand things, we do sometimes need to have that repetition and that that awareness in practice of what it really means, and then coming back to the mantra in terms of some of those examples. So I know we had more questions are coming in, so I'm going to attempt to just do a quick response to some of them, and then I'm going to do my last 2 slides. I'm conscious of time. So absolutely, Claire, you put in the chat, is there a relationship and connection to local communities and voluntary organisations? We could talk about that all day as well. So a lot of the focus in the community practice has been about working with local community and voluntary organisations to make those connections. So some of the spotlight sessions have involved them, and there has always been that focus on how can we support our staff to think about the least restrictive option, which can often mean tapping into local assets. So absolutely. I'm not going to be able to cover everything because more's coming in. We haven't really thought about this from a pathway perspective, Rachel, and certainly not from a patient pathway perspective. We do absolutely have a citizen journey, and it is about our kind of Care Act assessment process ultimately, but we're focusing more on the behaviours and the conversations within that rather than the process, if that makes sense. But happy to pick up another conversation about that, 'cause it's quite an interesting way of framing it. And then I just wanted to also touch on, which leads, I think, into this slide. I think someone put in the chat earlier around quick wins are really important with large scale change. I don't want anyone to think that I don't agree with that, because I do, from what I said earlier, but some of those really big impacts take a bit longer to come. And we did have some quick wins, absolutely, from the beginning. And you can see some of them here on this slide. So we have had some real positive outcomes on on outcomes, performance and demand. So probably unlike quite a lot of areas, we have actually seen a decrease in our commissioned home care hours over the last 12 months of 8%, which is pretty significant. I know it's a little number, but it's actually a little number on a big number, so it makes a big difference. So that has been significant. In addition, we've seen that our residential and nursing care admissions have remained low and actually remained fairly steady. So our sort of demand modelling into next year has re-baselined some of our budget around that now. And we do believe that is due to these different conversations that are happening with citizens that Rosie's described. A good chunk, so nearly 10% of our reviews that we deliver, again, they're all strengths-based reviews now, have resulted in long-term support actually being ended, and a further large percentage have resulted in some decrease in care packages. This is about right-sizing in the most restrictive option. It isn't about taking support away from people, but it is about the conversation that can lead to that positive outcome. We've seen a really significant increase into our reablement services from a community setting. And our reablement services are absolutely fantastic. Again, we could talk all day about them. And we've got an in-house service, and 61% of citizens leaving a period of reablement are requiring no package of care. Our monthly technology-enabled care applications have been going up. And likewise, we've seen a significant increase in our completed carers assessments compared to previous averages. And it's not the most important thing, but for some people on the call, it's something that you have to think about. So this work has had a direct impact in terms of delivering our savings and actually underspending on our budget in year. We've got lots more challenges to come. For those in adult social care, we're all thinking about the new charging regime and fair cost of care and everything else, but this is putting us in a good position, we think, looking forward. The last slide I'm going to do, because I'm conscious I've got 60 seconds. So sorry, everybody, there's too much to say. You can move me on to the next one. Oh, we could just go back. So more important really is some of the real life examples, and we had a fantastic scrutiny committee a couple of months ago where we invited some of our frontline practitioners to talk to counsellors about their experiences of the work, but we've heard loud and clear from our teams that this is working for them and is enabling them in their role, which is exactly what we want. Our recent staff survey results have actually shown a significant improvement across lots of domains, and I've picked one out there. So 92% of our colleagues across adult social care understand the organisation's values and behaviours, which is pretty incredible, I think, actually. And I think a lot of that is down to the work of this programme. And one thing we do, so alongside the counting stuff that I've talked about on the previous slide, the performance metrics type stuff, we also do a lot of work around impact. We haven't even touched on the tool that we've got, which is called My Views, which captures feedback from frontline practitioners on the ways of working, but also it helps us to identify some of those gaps and barriers to strengths-based working. What you've got on screen are some quotes that frontline practitioners have shared with us around how they've experienced the work around community practice in particular. And actually what we've seen is consistently, we've plucked a kind of a period here, but consistently nearly 100% of our practitioners have said that participating in a community of practice have helped or partly helped them to deliver and develop their strengths-based practice. So I spotted your question. My Views, yes, we've invented that ourselves. Rosie is the in-house expert on My Views, but it's a tool that we use to gather and collect feedback from practitioners focused on strengths-based working, and it feeds the whole Better Outcomes, Better Lives programme in terms of some of that that insight that you don't get from pure performance metrics. So I think I'm handing back to one of the Claires, am I? I think. Claire 1 or 2?
I think it's to me.
Go for it, Claire.
Brilliant. So I think that brings us pretty much bang on time to get into the breakout rooms. If we go to actually we can skip on a slide after this, which will tell us what we're doing. So we're going to split out, I think, into about 10 breakout rooms. So we'll have 7 to 9 people, depending on how the divide cuts into those breakout rooms. Just to give everybody 20 minutes to have a bit of a conversation about thinking of a current change you're delivering or getting ready to deliver. How could you apply some of what we've talked about this morning, whether that be Combi specifically, or some of the kind of real life examples from the Manchester programme. other Claire will bring us back in at the end of that 20 minutes just to kind of summarise some of that, but also give each of the groups a chance to share some of what they've discussed. So if each group could nominate somebody and kind of one of the key points, just one sentence. So we've got quite a few groups to get around of something you've discussed that you would like to share with the wider group.
So I'll just give it a minute or so for everybody to rejoin. And I just want to make sure that each group has got somebody who's going to feed back. So what I'll be doing is just sort of going through, if you can remember what room number you're in, that would be great. And if not, feel free to pop your hand up, and I can then see who would like to feedback. So I'll just give it another moment or so just to make sure everybody is back from the breakout rooms. I'll just give it another 10 seconds or so. Fantastic. Just want to check in. So let's go to, I think, is it Hannah from room 9? We're going to feedback. And then if other people want to put their hands up, if you said you're going to feedback, and then I'll call on you as and when. So what did you take from the from either the Combi or Manchester case study in terms of what you might borrow or apply?
Collectively, we kind of discussed both together and the learning that we've all taken on from this morning. And I know you want our sentence, it's not going to be grammatically correct, it's just lots of key things that spoke to us. So both Combi and the approach that was taken, we found the examples really relatable, really useful. The structure of Combi as a tool we found really robust, the inclusivity and the non-hierarchicalness. I know that's not a word, particularly around some of the visuals, but just conceptually. And we felt that the tool and the example of the application that we were given would be really facilitative to conversations, whether that's a workshop with service users and community asset groups, or a conversation with a board to get buy-in. And the projects that we all thought the Combi and this way of working might help with somebody within their organisations looking to reduce their carbon footprint, some and other organisations looking at tech and lowering alcohol. Somebody else is shifting healthcare interventions from the typical healthcare setting into the leisure facilities, and somebody else is looking at chronic vascular disease, impactful messaging and different ways of providing services. And we could see how useful Combi would be with that. Sorry, that was 12 sentences. Oh, shush.
That's fantastic, Hannah. And it's great to hear a range of different changes that people might be wanting to make. So ranging from the kind of cardiovascular stuff through to climate change and tech. So that's fantastic. I can see, was it Ali in group 8? Would you like to come off mute and feedback?
Hi, thanks, Claire. Yes. So our group, same as what's been said just before then, we all found we kind of talked through both of the bits of information really together. And we're coming at this from kind of backgrounds in health, from the Northwest Ambulance Service, and myself from a local authority point of view, and all kind of leading on very different things. So we can all see the opportunities and the structure behind how the models have been put over, and I think it was safe to say that we're all kind of enthused and our brains are whirling quite a bit. So we can kind of see where those kind of, especially Combi, I think, and the examples in the beginning, there were a few of us that talked about how we could see how they would be useful in not only kind of fostering kind of team and from team level kind of delivery, but actually using that model to be able to feed up to leadership to inform kind of pieces of work. So yeah, we felt we've got lots of things to think about, and it's been really interesting. Thank you.
Fantastic. Thanks ever so much for sharing, Ali. We'll go to, is it Angela in room 4?
Hi, thank you, Claire. Our group were made up of people who are perhaps a little bit newer to this, and we've come to the session to learn more about behaviour change, and felt that it's been so useful, and the model and the examples have been really good for us. We talk more generally about what we're doing. So one of our group members is involved in kind of the COVID vaccines, and we were using the model to kind of have that understanding of kind of motivations and perhaps barriers to motivations and opportunities, which was good, and kind of understanding the general public as different groups, especially when it comes to vaccine hesitations or being in favour. So that was quite interesting. And then we were just talking generally about kind of public health campaigns like weight management or physical activity, and how they're all linked, and how a whole system approach, perhaps not just an individual approach, is probably most useful.
Thanks ever so much, Angela. Yeah, great to see that it's sort of being applied in really sort of potentially topical ways. So obviously the vaccine rollout. Sharon in room 10, do you want to share your comments?
Yeah, so we had a general conversation, and there was a couple of takeaways for us. So I think we've all come on this session today to understand how to do change better. So we think we know what we're doing, but I think for our group and for me as well personally, the COM-B tool is a really powerful, simple to use approach to try and embed a different way of working and to get people to own change. And I think, you know, the comment about the behaviour is context dependent, and we can change the context so we can change the behaviour was really powerful. And then I think the other thing around the case study from Manchester was the power in setting up communities of practice to enable people to come together and share learning, share what's going right, share what's going wrong, as a tool and as a mechanism for empowering people to make the change themselves. So whether it was it might not be an obvious solution, but how powerful it is, and our colleagues from Manchester have demonstrated that, and it's certainly something that we would look to set up in our organisation. So thank you.
Thanks, Sharon. I'll go to, is it Claire Tompkinson in room 3? So very similar name to mine. So
I think I've been copied in a tweet instead of you as well, Claire. I was panicking I was a speaker today. I don't know where that came from. Like, no. Yeah, I think it really aligned with some conversations we've been having around organisational culture, and myself and Kat have both put that in the chat box earlier as well. I think where I work at Great Sport, we've been talking a lot about connecting people who want to do something differently and giving a load of support to enable them to develop the skills to do in terms of how they do it differently. So really aligning with the things you were saying about motivation and capability. The things that I'm really struggling with is then they're going back to work, and the organisational culture doesn't really give them the opportunity or the freedom or the power to implement the change that they're identifying themselves. So it's enabled me to really think about, okay, so we've got the motivation and the capability right. We need to look much, much more at the wider organisations of where people are and where the opportunities are, and how we understand the resistance to that change and how we connect with that from an empathy point of view. Yeah, so that's kind of where we were at, much more focused on the opportunity.
Thanks so much for sharing, Claire. Yes, it's really important to kind of unblock some of those barriers that people face when they're trying to implement those changes. So actually thinking about who are all the different organizations and places that need to get on board, and having a real shared vision and that kind of ambition that everybody's bought into is really key, and it can often be a useful starting point, so that everybody's at all levels are kind of bought in, so that people on the ground can make those changes. Fantastic. I think we've got, is it Jackie in room 6?
Yeah, hi. Unfortunately, there was only 3 of us in room 6, and I think it was just a session for me, really, to be honest. So so I thought, no, I've really enjoyed so far, and I think there's lots of things. I came into it not really knowing about COM-B, and also change behaviour. And I think that for me, there's lots of things that I want to take back to my organisation. We are, in terms of how we influence change, and particularly around strength-based approaches. When I reflected, I think when I've reflected on that, I think one of the reasons for myself why strength-based approaches hasn't necessarily maybe had as being embedded as positively and as effectively as it could have done is the importance of everybody being influences, certainly myself as a leader, a team manager, and everybody in the organization, sort of exuding strength-based approaches and using it in all areas. So I think the importance of being able to do that, so that the experience of front practitioners and everybody is strength-based or part of any type of change is really important. So I think when I reflected, I could see where frontline practitioners in particular, were having different experiences and different messages. So collectively, we weren't, we're always struggling to embed change because you're just getting so much inconsistency. So I think that for me, that was and enthusiasm and different ways of working. So I think that's really important. And also I think it's going to be really important for me because we're just doing the carers strategy at the moment. We're really struggling to motivate and engage carers as a population within that strategy, and I think it's given me a lot to think about in terms of why that is and how we're going to engage people, what their motivations are. So it's given me, I think it's given me a good tool to look at that and then possibly inform the way we might have to do things differently to make sure that we're involving carers.
Thanks ever so much, Jackie.
Okay.
That's great. Hayley from room 5.
Thanks, Claire. Hi, everybody. I was quite privileged. We had a really good group. We had Anne from the NCA talking about DLAC approach of using data and impact and using that to drive change and conversation. Martin from Rochdale, who described a lot of leadership development around OD. Grace over at the CCG around embedding green into everything and anything that was being driven forward, and Rachel from Public Health reflecting on the impacts of COVID and now, okay, what's public health to do beyond COVID? And then myself reflecting on some work of driving the, very similar to Manchester, our innovation savings programme for adult social care over in Bury. What became clear is actually we're all driving or part of steering change and transformation, and behavioural science had a key aspect within that. So on the theme of the session, we tried with the combi and looked at as a group of change makers, if you like, that the capability in the room, there was lots of confidence, knowledge and expertise within the group itself. To drive that change forward and bring others on that journey. The opportunities within all our programmes, we described the opportunity of engaging more with our teams and services and taking that feedback, very similar and well described as Manchester do, through the communities of practice, and actually sharing that back with the services and across the system. We don't feel we do enough of that. And in terms of the motivation, all had our independent motivations within our own individualities, personal life and skill set within work. But also this session today has really helped drive that motivation and given us some of the tools to apply that. So yeah, that's the snapshot from room 5.
Thanks so much, Hayley. We'll go to Steve and then we'll in room 7, and then we'll finish up with Hannah in room 1. So Steve, what were your group's comments?
Yeah, the sort of briefly, there was 3 people who had similar challenges around a sort of change across organisations, and I suppose the big takeaway for me was that people are part of the solution, not the problem. So actually, where organisations are having to make budget cuts, it shouldn't necessarily be assumed that that's going to be through people being lost, because actually people are a big part of the transition, and people are needed to make the changes that are required. Beth and Wirral cited an example of having to avoid a top-down change being imposed on people, and actually engaging with staff to sort of co-design and co-produce what they think might be the changes needed in Wirral to make the difference and enable an improvement in the system, but actually make those budget changes. And we felt that actually by involving staff, that was very motivating for them during any sort of transition journey, and that leaders need to give staff time to take on board any sort of training they needed to help them do their job better. And Ellie from MIA suggested that it's perhaps really challenging at the moment through the pandemic and everybody working from home to actually see the changes in the way that you might see them if you're in an office. So we had a little bit of a discussion about the merits of hybrid working or not. But overall, I think the takeaway for me would be that people are part of the solution, not the problem, would be a big plus for me.
Thanks so much, Steve. And we'll just wrap up with Hannah in room 1. What comments have you got to share?
Yeah, hi everyone. Very similar actually to a lot of the points that have already been raised by the other groups. So there were lots of different themes across the group that people thought that the models could be used for, including healthy weight strategy and also digital and organisational projects. We then spent quite a lot of time talking about the community of practice approach and getting more people involved. So again, similar from removing that sort of top-down approach and actually getting real life feedback from people on the ground and the impact that will have for individuals' well-being, and sort of spreading that across, especially in the times we're in right now and throughout COVID, about the benefits that community-based approach, probably the community of practice, would have had on the individuals taking part in a really challenging time. So yeah.
Thank you ever so much, Hannah. And I just want to say thank you ever so much to everybody who's had a really rich discussion over the last 20 minutes. It feels like the combi work and the case study from Manchester has really sparked some great discussion. I'll go to hand over to Bernie to wrap things up.
Thank you. I don't know if time's gone. That I really enjoyed this morning. I hope other people on the call did as well. Great to hear that you found it useful and thought-provoking. Great to hear the real kind of enthusiasm in the room as well. Hoping that through those discussions, you've obviously a number of you have already thought of areas where you could apply behavioural science into your own settings. Can I just say a huge thank you to all of our speakers today. Claire Harding and Claire Tomlinson, start off with. Between you, you've got, I understand, over 25 years experience delivering sustainable change in the public sector. I know Claire Tomlinson has been working with us in Manchester on our Better Outcomes, Better Lives programme, and we've really benefited from that behavioural science approach. It's been a real enabler to supporting us on our journey to deliver those sustainable change, embedding strength-based practice at the front line and supporting us to manage our demand, which is really critical, and really importantly, deliver better outcomes for the people we serve, whilst also enabling us to deliver savings. And I know Claire Harding leads on the Impower's Applied Behavioural Science group, and she's always on the lookout for different ways to deliver behavioural science approaches. It's great to hear some of the examples you've shared today. And I also want to obviously thank Sarah and Rosie. You did a great job bringing the work that we're doing in Manchester to life. I have to say, I've got to use the opportunity to thank our staff. I'm really, really proud. They've embraced this change. They own this change. And it was no mean feat because we're doing this in the middle of a pandemic. So it's been extremely challenging. One thing I would say is it's important to wrap the right resource around it and give the staff the tools to deliver the change. They are absolutely embracing working with people in a different way, supporting them, building on their strengths and supporting them to have better outcomes in their lives. Thanks also to the team today for helping us run smoothly. It's fantastic technologically, the ability in the room. Thank you. And thank you to the Northwest Collaborative and all our partners for the support in putting the event together today. We'd be really grateful if you could give some evaluation. I think that's going in the chat. I'm just going to try and open my chat. If somebody can, if the comms team can put the link in the chat box for the evaluation, that would be brilliant. I also take the opportunity to invite colleagues to the next event on March the 31st, Thursday, March the 31st, where there's going to be an event looking at the outlook for the public sector. And there's lots more 2022 events in the events brochure. There is an NHS Big Conversation session on the 11th, 12th of May. So just a huge thank you to everybody. Have a lovely Friday afternoon and a great weekend, and hopefully you'll be left feeling inspired about applying behavioural science within your own settings. Thank you, everyone.